Hello viewers, I am Dr. Lakshmi Kiran. I am a fetal medicine specialist. Today we'll first talk about how to plan your pregnancy. It's always, whenever any couple is planning a pregnancy, it's always better to visit your gynecologist first for various things. If you are healthy, it helps to check to make sure you are fine and reassure yourself of that. But sometimes when we are making sure you're healthy, sometimes small problems that can be corrected before pregnancy might be diagnosed, and it helps to correct certain things. And the most important part you will be advised about before planning a pregnancy is to start on vitamin called folic acid. That will help the baby's formation once you conceive, and it is best started at least 3 months prior to the conception. So what will happen when you come for your preconception counseling? First, we'll try to find out about you, your details, your cycles, whether they are regular, if they are irregular, how to correct them, your height and weight. If your BMI is high or your weight is high, we'll help you correct your weight with dietary advice on exercise. You should understand that starting a pregnancy with normal weight helps you go through with the pregnancy better. Normal weight helps easy conception. It will help to keep your cycles regular. We then find out about your general health, whether you have had any specific health issues before. If you do, how to correct them. For example, it's common enough to have thyroid issues, if your blood sugars are high, if you have any health issue like thyroid problem, hypertension, all these things have to be corrected. Everything should be optimal by the time you are ready to plan a pregnancy. Considering your husband, it's important his health has to be good too. Any diabetes, thyroid, any such problems in the husband can also delay conception. If the husband is a smoker or an alcoholic, that can also delay conception. So all these things can be corrected preconceptionally itself. It's important to understand that you should not conceive with suboptimal health like low hemoglobin, we call it anemia, abnormal thyroid levels, abnormal blood sugar levels. All these can lead to problems in pregnancy. So these are best corrected before pregnancy happens. So we ask details about whether you have had any infections in your childhood, what is your vaccination profile. If you have not had vaccination for chickenpox or not have had chickenpox in childhood, rubella, such problems, we vaccinate you pre-pregnancy itself, because any such infections during pregnancy can lead to problems in the fetus. The other things we help with is to make a plan for the pregnancy. Especially this is important for people with specific health issues who had problems in the last pregnancy, the ladies who had repeated miscarriages, the lady who has had a cesarean section in previous pregnancy, had a diabetes in previous pregnancy. All these women need to plan the pregnancy carefully, come for a preconceptional counseling. Other region where preconception counseling can help is if you are having difficulty in conception. So certain subtle things that can be corrected to ensure you conceive easily. Explain the fertile period so that you can try at the right time. Check your uterus and ovaries, make sure there are no problems with them that can lead to fertility problems or that can lead to problems in pregnancy. Taking care of all these things much before you actually conceive will make sure your pregnancy goes well and you go home at the end of all 9 months with a healthy baby. All the best.